She doesn't have 6 months to live. Hospice, even though they say it's free if Medicare is involved or if you have insurance. And they do pro bono, but I've fallen in the gaps again because the pro bono cases, they're full up at the moment. So I have my people in there. I'm trying to get in touch with the brother. She has no other relatives. We can't even get the medications for free, and they're so expensive. Like one bottle of hydromorphine, I had to go and pay for my own money today, which I don't mind. I'll get it reimbursed from somewhere. Was $140, and that's just enough for about a week. And then other insurances. I've been given lots of diapers, sheets, a lot of support from all the hospices. So don't misunderstand me. Hospice is good, but so many people now that have lost their jobs, so have lost their insurances. So the need is more than ever. And I have veterans coming home from the war, and they don't have enough help in the home. So families are, under a great strain if there's children in the home, because some of them have psychological wounds as well as disability. And I've just taken on 2 veterans this week that were from previous wars, and they're only allowed 6 hours a week. And one of them is a quadriplegic in a wheelchair, and he wants to stay in his own home, and he's been spending his own money, and hopefully we can appeal some to the veterans so that they will give more money. And it could go on and on and on. But the good thing is, I really think people like to feel needed, and you learn a lot. And I think that's the biggest gift of all, is when we all come together, and it's been proven over and over that it works. People really love to belong, and they have good hearts. There's a lot of good people out there, a lot of good doctors, a lot of good nurses, and even in hospitals. But they're all under a strain. They're all under a terrible strain. And so hopefully, with all of your help, we can get Coming Home Connection off the ground. I've been told it's the only organization like it in America. That's what Robert Wood Johnson told me. And so I'd like to see it taken to other states. I'd like to pass it on to young blood. I'm running out of energy. It was my vision. It's not my vision to make money from this. I would like a salary, or more than half a salary, but I'm fine. So do you have any questions?
For the microphone, what we will do, if you could repeat the questions.
Yes.
So my question would be, so you don't have anybody paid? I mean, you don't have an organization that has nurses on staff, like a traditional hospice organization?
No.
Okay. And your doctors, and also they work pro bono then, the medical director?
Yes, my medical director works for free, Roger Miller, Dr. John Redd, who's epidemiologist. He works with the Native Americans, and he also calls me about certain cases that he sees up on the reservations that need help. Yes. No, everybody's pro bono.
But
I make a small salary.
We do accept donations.
Oh, yes, yes.
Anybody, like a benevolent family member that sees the terrific work that's being done and how this patient's life is turned around for as long as the life is, want to do something for Glennis, the organization, or the volunteers, we accept donations.
Yes, and a lot of families. I have my first fundraiser in November, And the Nessies gave me their place to have it for free, and they gave free food, not dinners, appetizers, which was great. The music was great. And I just asked people to turn up and pay $20 if they had it at the door, and I made nearly $20,000. I was shocked. People that I had nursed in previous years, people sometimes came and just put $100 in. And I had told everybody they didn't even have to pay if they didn't have it. So that was my first fundraiser, and it was huge. And then Kitchen Angels, they have partnered with me. They do free food. And so they said, all right, Glennis, we'll do free food, and you do free medical. So that's a good partnership.
So
Yes?
I know that there are trainings.
Yes.
For the volunteers
Yes.
to go to the home.
Yes.
What is their scope of practice, and what can they cover? Like if I volunteer, what can I actually do for somebody?
Okay, first of all, I would, after the training, I would ask what you wanted, where you felt you fit in. Then I'll take you out with me, or I would place you with somebody that's more experienced till you felt safe and comfortable. And you could always call on me.
Let me answer the scope of
Yes.
practice question, because that's the one
Yes.
that's going to get us into trouble or not.
Yes.
Get close to the mic.
I will. So Lisa, I'm
Here's
answering
my
your
mic.
question about what are the volunteers that are trained for the weekend, what are their backgrounds, and what is the scope of practice? Well, we have a wide range. I think initially when I talked to you guys, I was describing the huge gamut of people that we get. And many of them have medical caregiving backgrounds. Because we are a nonprofit, we are not under the guidelines of Medicare, Medicaid, or JACO. But keeping that in mind, it is all about safe practice. So what I train the volunteers and what you guys would be involved in doing, if you would be so kind as to come March 28th and 29th. It's a lot of fun. We do have a lot of fun. We have a hospital bed. We have DME, durable medical equipment, that is in the conference room at the Cancer Treatment Center. I trained the board before I trained anybody else. They were all quite impressed.
Yes.
And I train around concepts about the population that we're going to serve, about ideas around cultures, nonverbal and verbal communication, about what you might see in the home, making a safe environment, and then a lot of the time is spent on actual bedside care. We are not doing any sterile procedures. We are not doing any wound care. Roger Miller does the wound care, and he trains volunteers who are appropriate for that training to do wound care. That's not what we're after. We don't give IVs. We don't give injections. I think it's easier to speak to a body of nursing students to say what we don't do, so you know what we do is what a certified nursing assistant would do for the most part. So that's kind of my expertise, and I sure learn a lot from the volunteers as well. How to get it's a lot of safety and first aid as well. How do we get a patient up off the floor? How do we read what this patient can do? How do we promote independence and yet
positioning.
keep them very, very safe? We do a lot of positioning and transferring, I can promise.
And change diapers.
Cooking, absolutely. Cleaning the refrigerator out. Again, that's
Yes.
around safe environment with the patient's permission, keeping passageways clear. Yes.
Yes.
So, would CNA license would not be required?
No.
No.
We would take anyone off the street.
Yes. And I mean anyone.
Really, we've never
Yes, and I
refused
trained
anyone training, and you know the most unlikely people, they walk in and you think, oh, turn out to be the biggest angels. And we need
Yes.
help in the office as well. We have a lot of
Paperwork.
mature women that come in, have 300 PhDs or masters or whatever, and they're retired.